Well, good Wellness Wednesday, everybody. It's Dr. Hoover with Mother Earth Labs, and I want to welcome you to our show today. We're so glad that you're with us, and as we get started, let me just do a quick sound check. Sounds like everything is going well. If you'd like to, you could post in the comment section that you're hearing us okay. I got a very unique show for you today. I'm not going to be talking so much about products today, though I will kind of wrap up with a very good program that anybody can kind of plug into. But today I wanted to take a little bit of time and address something somewhat personal to me, and that is kind of what I like to say is a new type of healthcare system. I've got on the page here, it says an ounce of prevention is worth a pound of cure. Boy, that old adage is so true today. And I'm going to kind of share a little bit of a personal story with you that my family has been through this year. I don't usually like to share personal information out there, especially about health issues, but I think this is a pretty relevant thing. It's very fitting for today. I get so many people, customers, even health professionals that I'm talking to that are so concerned about the cost of health care today, the cost of health insurance. And I'm going to share something with you that we've personally experienced this year that has just absolutely been a blessing, not only for a peace of mind for kind of what's in place for our healthcare plan, but also really helping as far as costs this year. It's really a pretty remarkable story. But with that, before we get started, I want to let you know that the information that we share here on our Wellness Wednesday shows is purely for information. It's not designed to diagnose, treat, cure any medical disease or condition. You should always check with your medical doctor about any medical issues that you're having, okay? So with that, we're going to get started. I want to flip over real quick to my new buddy here. Not my new buddy, but my buddy that joins me every week. I set up the Murph cam. This is Murphy. Murphy's my little sidekick. She's in the office with me all the time. This is my little boisterous 10-pound schnauzer, toy schnauzer. You'll see she's got her pet wellness formula there beside her. She likes keeping an eye on that. If those of you who haven't tried our pet wellness formula, it really is a phenomenal product for your animals. As you can see, it kind of even calms them down a little bit. But Murph's just enjoying her afternoon nap here in the office. But I've had so many people that have caught a glimpse of her down beside me when I do my broadcast, and they're always asking, what is that on the floor beside you? So I'll kind of incorporate Murphy in our shows each week. She loves hearing this information every week, I'm sure. But anyway, I want to kind of get started. I've got a little presentation I'm going to go through today, and I'm going to talk about a alternative to health insurance. At the end of last year, my wife and myself, who we've been with Blue Cross Blue Shield for years, probably 15 years. Like many of you, we noticed that our health insurance premiums just continue to go up and up and up and up, and especially with all the changes in healthcare over the past few years, it's just really gotten out of control. And when I got our statement at the end of the year showing what our premiums were going to be coming up for the next year, it was almost enough was enough. I said, I'm just sick and tired of overpaying for health insurance, and today especially paying for things that we really just didn't need. Things like maternity. We've had our kids are grown up, we're not having any more kids. Why am I forced to pay for maternity in a lot of other health coverage? And it was just one of those moments of going, what do we do? What do we do if we come off the health insurance grid? Do we just take a chance, which I really don't recommend. I don't think that is the prudent thing to do. Health insurance has evolved over the years to kind of being this be-all, end-all and covering everything, instead of how it used to be, which was more for kind of major medical coverage. And my personal opinion is that's really how health insurance should be looked at, is if something kind of catastrophic happens, that we've got that coverage there. Almost kind of like our car insurance. I've used this analogy on our show before that, we go buy a car, we're given an owner's manual, we insure that car. In the owner's manual, it tells us to change the oil at every, so many miles, rotate our tires, do preventive maintenance. And, many times that maintenance could be pretty expensive, but we just pay it. We don't file an insurance claim when we go get our oil changed, or we rotate our tires, or we do the recommended maintenance. It's just something we do to take care of that because somebody instructed us to do that. Well, part of the problem with our health is, over the years, I think we've just deprioritized our health, and we haven't really kind of had that owner's manual of what we should do. But, when you think about chronic disease today, over 80% of all chronic disease, this is diabetes and weight problems and inflammation and arthritis and cancers, these are preventable, folks, preventable. And, we're just not doing the preventive things we need to do. We just have kind of gotten really dummied down when it comes to our health. And then we think we got this health insurance program there that's going to kind of cover everything. And that's part of what the problem is today. There's such a burden, I think, on the medical system because people just really aren't paying attention to what's going on with their health. So today, I'm going to take you through a little bit of a personal journey that my wife and I have been on this year since we came off the health insurance grid, I like to say. So let me kind of pop over to this presentation here real quick, and we'll get this put up. And again, we're all concerned with healthcare costs. I don't think a day goes by that I don't discuss the problems with healthcare and the concern with the cost of healthcare with people. And, again, at the end of the year, my wife and myself, we made a decision that we weren't going to continue to pay these high insurance costs. Our premiums for 2017 were going to be $1,400 a month for my wife and myself. So that's $16,800 a year. We had a $12,500 deductible. So if we had to use that health insurance this year, our out-of-pocket costs were going to be $29,300. A lot of times we forget about that premium we're paying every month. We just think, well, that's just a fixed thing. But boy, that's, I don't know how most people could afford this. We certainly were at a point of going, we just can't afford to continue to do this, these 30-40% increases on health insurance. So we decided that enough was enough, and we were going to come away from it. Now, for many years in my practice, dating back to the early 90s, I have heard about a program as people are kind of looking for alternatives for healthcare coverage. It's called Christian Care Ministry, or Medi-Shares. Many people are kind of hearing about Medi-Shares today. I'll be honest with you, I never really took it seriously. I had clients coming in saying that they were going to it and it was a great program. But when we decided to end our health insurance program, I knew we had to do something because, today we just can't go out and elect to have a major medical plan or, a plan that's catered to us. The government's kind of telling us what we all should be doing when it comes to health care. So I really started investigating Medi-Shares. And let me just tell you a little bit about what Medi-Shares or Christian Care Ministry is. It's really a movement whose roots were founded in the early church. It's about sharing lives. This has been going on for thousands of years. It's built on faith and the talents of a lot of good people and resources. For Christians that have come together through this program, caring for one another, and you're really kind of lifting a lot of these burdens that we deal with healthcare off of our shoulders. So Medi-Shares was formed in 1993. It's been around quite a while. It took a formalized approach to sharing healthcare burdens and then began with the Medi-Share program. So from very small beginnings, this thing has really blown up. I had no idea how big this had become. But over 23 years, Medi-Share's program serves more than 250,000 people, or members, and they've paid out more than $1.7 billion in medical bills have been shared through this program. It's really pretty phenomenal. When I look at this, I really think this is a program that really all of us should be looking at. I don't know why these Congress people and senators aren't looking at a program like this. It's really pretty phenomenal. What appealed to my wife and myself when we began looking at this is that it was a very affordable program. It was a biblical healthcare alternative, which we like being Christians. Medi-Share is a healthcare sharing ministry where members share each other's medical bills. It's a God-honoring healthcare system. It's affordable, acceptable under law, and I'm going to get into that here in a little bit because I've had some people ask me, well, who participates in this? But it is an acceptable program. It's a Christian community sharing each other's medical burdens. Now, I want to kind of walk you through what our cost was. You remember I just shared with you a minute ago what our premiums were. They were $1,400. And I can tell you that over the course of 5 or 6 years, our health and care premiums went up from $600 a month for my wife and myself to over $1,400, which is pretty staggering. So when we looked at this program, we had different options. And when you look over here to the left under your household portion, think of that almost like a deductible, which you would be paying each year. And then you have what they call a standard monthly share. Think of that kind of like your premium. And so we elected to go with a $5,000 annual household portion. Remember, we were paying $12,500 for our deductible before, and that set our monthly share for my wife and myself at $468. So that was quite a savings, really over $1,000 a month for us on savings. So again, think of that household portion as your like deductible. The standard monthly share is your monthly premium that we pay in each month. So that basically came down to $5,616 in our monthly shares per month, a $5,000 annual share for a total cost of $10,616. Now remember, that's if we had to use the insurance. If we didn't use it, we wouldn't pay that extra $5,000. So that was a whole lot easier pill to swallow than $29,300. So that was quite a savings. So almost $19,000 a year that we were saving. So we were pretty excited about that. So unfortunately, early in this year, we were only 2 months into our Medi-Shares program, we had an unforeseen emergency that showed up. This was right after canceling our insurance, and I'll tell you what, it was a little bit nerve-wracking. Not only my wife going through this event, and again, this was an unforeseen thing, nobody could have predicted it. And I'm actually showing a page of some of the bills that were coming in. If you look over here, the hospital bill alone was almost $125,000. This total event generated over $150,000 in services that we were sitting here looking at. So, of course, our faith was really being tested at this point. Here we'd come off of the health insurance. We had this unforeseen emergency happen. Praise God that my wife got through this. She's well. But this is the type of event I think that unfortunately ruins so many people today, with these healthcare costs and not having insurance. So, we were kind of riding this thing out, wondering what was going to happen, and certainly had to step out on faith that this program was what it said it was. Well, it just amazed me, the professionalism in communicating with the Christian care ministry people, and getting on the phone with them and discussing what was going on. And it was always such a blessing to get off. As we were getting off the phone, they would always ask, "Can we pray with you?" Which I think today is so important. That we do pray, and trust me, we were doing a lot of praying through this process. And I wanted to just kind of show you this explanation of sharing. This would be like an explanation of benefits that we would typically get from a health insurance company. And folks, what I'm sharing with you are our actual numbers. These are taken right out of our member account. That hospital bill that was almost $125,000 was discounted down appropriately, just like most health insurance companies do. And our responsibility for that $125,000 bill was $885 that we would end up paying to the healthcare system, the hospital that Barb was in. It was just phenomenal when we were seeing all of this taking place. And, the beauty of it is they are associated with a very large network, PCHS. I was very familiar with this healthcare network. It's one of the largest in the country. All of our medical providers participate with Christian Care Ministry, our primary care doctor. The hospital that we went to, the emergency room, everybody, gladly took this, participated with it, knew exactly what to do, and things were taken care of as they should be. This is part of the member portal. You're constantly notified of how your money is being taken each month and shared. You can see this first notice here. It shows that, out of our monthly payment of $468,391 was combined with another $18,810 to help share another family's medical needs. The one below that says 271 members shared in your need. So that's $78,382 medical bill just for the hospital was shared amongst 271 members and paid. And folks, I'll tell you, I am such a believer in this. I wanted to just take a little bit of time today to share this with you because so many people today are just really don't know what to do when it comes to healthcare cost. And it's a shame, we're just kind of lost on what to do, where to go. We just think that, if we either have to pay these high prices for medical insurance or we go without. And again, I don't think that's a very prudent thing to do. So, this is a really a wonderful program. I just posted a link, by the way, under our live event here. You can actually click on that link. I'll kind of put another one up here that says Medi-Share link, and I will post that again, and you can actually click on that and go over and learn about this wonderful program. So if you're like myself and my wife and you're just very concerned about these rising costs of healthcare and you're looking for a viable alternative, folks, all I can tell you, personally, we found one. I've been in the healthcare system my whole life. We have had health insurance our whole life, and it was kind of a scary thing to think about coming away from that. And what if we had a catastrophic event? We practice what we teach. We really live a good, healthy, clean life. We don't really have any major health issues at all. We don't take medications, and all of a sudden, out of the blue, something like this happens. You can never predict what may show up or what may happen. And thank God for Christian Care Ministry and Medi-Shares. So I just wanted to share that today. I hope it's something you'll look into. I don't like, promoting a lot of things, and there's no financial gain for me in this. It's just something I wanted to share with you today because I know there's a lot of people out there that are in the same boat we are. And, along with that, I think that the key part of this as well is making sure that you have your health care plan in place. And, when we look at our health care system today, we really don't have a health care system. We have a great medical management system. As far as medical emergencies like my wife had, it was remarkable what they were able to do to literally save her life. If we're in a car wreck and we've got to be put back together, this is the best country in the world to be. But when it comes to health, we really don't have a healthcare system anymore. It's like I've talked about many times on the show. We're either put in a normal category or a disease category, and until we become diseased, really nothing's done. It's almost like, well, let's just wait and see until you get there. You're not quite diabetic yet, but maybe next time I check you, you will be, and then we'll start treating you with drugs. There's not a prescription drug on the market that's prescribed that we're deficient in. We don't have a deficiency of Lipitor. That's why our cholesterol's high. That'd be like me saying that you get headaches because you don't make enough aspirin in your body. So, prescriptions manage things. They don't fix things. So the fix is right here, folks. It's our body. Our bodies were completely designed to be disease-free, to fight being overweight, to fight inflammation, to fight diabetes, cancer. That's really the way it should be. And again, as I mentioned earlier, we just have kind of become dummied down, and we just don't take care of ourselves. I think we feel like, well, we'll just go to the doctor when it gets bad enough, and they'll take care of it. And we can be managed real well. But when it comes to truly getting to the cause of disease, it's our responsibility, each and every one of us, to become empowered and really become our practitioners. We folks are the best healthcare system, each and every one of us, and we have to participate, and that means that we have to become educated about what it is we need to be doing to care for this vessel, this vehicle, like I mentioned, that car. We need to start paying attention and doing some preventive maintenance. That's really what we're all about here at Mother Earth Labs. I've been in the functional health field for 23 years. I managed a lot of conditions over the years naturally with different products out there. At one time we carried almost 300 products in our wellness center. until I was fortunate enough to hear Carrie Lynn Carter, the founder of Mother Earth Labs, speaking at an event I was at in Austin. And she really changed my whole mindset and dynamic on what really was essential when it came to supplementation. You know, let's face it, our food's being processed and manufactured and engineered today. We're not getting the nutrition that we need in our foods. And this is where we have to really begin first, is looking at what is it that we're putting in and what's the net effect. I always like using the net effect. When I'm consuming something, what is the net effect? Is that going to be something that's beneficial for my body? Or is it just something that tastes good, that maybe makes me feel good, but it's providing no nutritional benefit? And folks, we got to start thinking beyond just the pleasure, the satisfaction, because you know what? Food companies today hire chemists that take sugar, fat, and salt, and they just tweak this stuff to make, and other chemicals that make things taste good. So when we eat it, it makes us feel good. It makes our brain feel good. But you know what? It's doing nothing for us from a cellular level to help our body restore and make energy and repair and maintain vital health, you know, the way it was designed to do. So there's an old adage too we use in our business. It's garbage in, garbage out. And so you've got to know what you're putting in. You know, on last week's show, excuse me, let me get a little water, I talked about a healthcare program that anybody could plug into. You know, I had Dr. Watts on last week. We shared a remarkable case study of a gentleman that really was able to reverse his diabetes, reverse his high blood pressure, his high cholesterol by really taking charge and doing things to help himself in a relatively short period of time. You know, over the years, I've used a program in my clinic that has worked very well. I'm going to kind of click over here to it real quick. We actually have posted this up on our website for people. This is free. It's called our 8-week to health program, or 8-week health restoration program. If you go to motherearthlabs.com, all the way down at the very bottom in our footer under customer support, you'll see 8-week health restoration plan. You know, there's so many diets and different programs and things out there that come and go. And I'll tell you, folks, this is a program that I have used in my practice for years. There's nothing I like to say that's rocket science about this. This really gets down to just teaching you to eat good, healthy, balanced foods, not putting you on some hardcore deprivation diet that you can't wait to get off of. So we've got a restoration plan guidebook that you can download here, and this really kind of walks you through the different types of foods that you should be eating, portion sizes, very easy to follow. Even has a supplement schedule that we put together for you, so I encourage you to download that. Here's a video that we've put together on the 8-week health restoration program. It really kind of covers the dynamics of the program and how we really focus in on gut health. You know, without a healthy gut, folks, I'll tell you, it's very hard for you to obtain and maintain good health. And well over 80% of our population today has a dysfunctional gut. A lot of people hear the term leaky gut today, which is not a good term, folks. And so that's, you know, a lot of where we focus in. We've put a very simple exercise program up. Here's our daily food and supplement plan. On this, I'll just open this up and enlarge this a little bit so you can see it. But this actually provides you with a protocol of how to use the supplements in our program. So I'll kind of center that here for you so you can see that a little better. We use our Replenish Protein is kind of a supplemental protein product throughout the day. We use our pH Balancer, which is our most dynamic, all-in-one, multi-nutrient product, plus our Lugol's iodine. You know, I tested over 10,000 people in our wellness center for iodine levels and found 90% just were catastrophically low in iodine. So iodine is a big, big need in our country today. Our GI Ultramex product, and also our Fulvic 400X minerals. You know, people are horribly demineralized today. We're not getting the trace minerals that are needed in our foods today. I talked about, you know, our foods being engineered and manufactured and basically made up in labs, even things that are grown in the ground today because of overcultivation and chemicals that are used on the soil that stunt microbes that help make the humic and fulvic molecules that we talk about so many times on our show are lacking. So, you know, when we talk about supplementation, supplementation is really vital today, and we have to make sure that we're putting the right things in. We always start there with the foundational things to begin building our body back, and that is so important. So, you know, we've also have healthy recipes area. If you click on the link here, this will take you to a page that has literally hundreds of recipes that we put on here for people to follow. So this is really a very easy system to plug into and use. By the way, this is free for you to use. All you have to do is go to our website, go to the bottom of the page and click on it, and voila, there you are. You have it right in front of you. So let me click back out of this real quick. We'll get over here and we'll kind of get to wrapping our show up. But you know, today I wanted to just take a little bit different approach with our show and talk about what I really see as a true healthcare system today. You know, I think this, what's happening with healthcare today, the whole system's imploding. I think it's going to continue to implode. And what's going to happen is it's going to force us to just really step outside the box and begin to understand that we have to begin taking responsibility for our health. We have to be good stewards. You know, we want to make sure we have something in place. I've shared with you today what I consider a very good alternative for health insurance if people are really concerned about their health insurance premiums and maybe they can't afford it anymore and they really want to get something. So I would encourage you to visit that link that I posted under our Facebook page. Learn more about Christian Care Ministry and the Medi-Shares program. Take advantage of our 8-week health restoration program. That's free and plug in. And we certainly hope that you take a good look at our dietary supplements that we do provide here at Mother Earth Labs, because I can tell you, being in the functional health business and working with thousands of people around the country using these products work. They simplify the approach to supplementation. You know how many people out there can go to their medicine cabinet right now or a kitchen cabinet and open it up and they probably have supplements falling out on them. I know I used to have people come in my clinic every week, and that's what was happening with them. They were just overdone with taking supplements. They were just taking handfuls of things per day. Be good stewards of that vessel and really supplement appropriately, and learn more at motherearthlabs.com about appropriate supplementation. You know, if you have any questions about what I've shared with you today, you can certainly email us. I would be more than happy to reach out to you. You can send us a message here through Facebook. I get messages all the time from people around the world here on our Facebook page, and we typically answer everything within 24 hours. So, well, again, I'm Dr. Stuart Hoover, Director of Medical Services here at Mother Earth Labs, and I'm here with my sidekick, Murph, today. There's Murph Cam. You can see Murph was pretty jacked up for our show today. She is such a good little sidekick. She hangs in there with me. I'm sure Murphy has heard this stuff over and over and over again her whole life, so she's got it down. Try our pet wellness product. You'll see wonders with your pets. It really is a phenomenal product. Well, folks, have a wonderful and healthy week, and we will join you next week here on Wellness Wednesday. Take care.